How the vagus nerve influences inflammation. The cholinergic anti-inflammatory pathway. A key mechanism is what researchers call the cholinergic anti-inflammatory pathway. Signals carried by vagal circuits can reduce production of pro-inflammatory cytokines, notably TNF, and others, through cholinergic signaling and immune cell receptors, often discussed in relation to alpha-7 nicotinic acetylcholine receptors. What that means in plain terms, the brain and autonomic nervous system can turn down excessive inflammatory signaling via nerve-mediated reflexes, rather than only via hormones or immune pathways. Bidirectional signaling. Inflammation also feeds back to the brain. The vagus is also a major sensory channel from body-brain. Inflammatory signals from organs, especially the gut, can influence brain circuits involved in sickness behavior, stress responses, and autonomic output, potentially creating loops where inflammation and autonomic imbalance reinforce each other. Vagal tone, HRV, and chronic inflammation. Because vagal activity affects heart rhythm, heart rate variability, HRV, is often used as a rough, non-invasive proxy for vagal influences. Across studies, higher vagally mediated HRV tends to correlate with lower inflammatory markers, for example, CRP, IL-6, though this is association, not proof of causation. What this looks like in autoimmune and inflammatory diseases. Rheumatoid arthritis (RA) is one of the most developed areas for bioelectronic approaches. Clinical work has examined implanted vagus nerve stimulation, VNS, as a way to reduce inflammatory signaling and disease activity in patients who have not responded well enough to medicine. A pivotal sham-controlled trial design, RESET-RA, has been published with safety/feasibility details and trial context. Earlier clinical reports also suggested VNS can reduce cytokine production and improve RA activity measures in some patients. Key point: this is not wellness gadget territory. The RA work generally involves carefully dosed medical devices and clinical protocols. Inflammatory bowel disease, Crohn's, ulcerative colitis (IBD) is strongly linked to the gut-brain axis, so it is a natural target. Evidence includes a small pilot study in Crohn's disease exploring chronic VNS as a therapeutic approach. More recent work includes transcutaneous auricular VNS, TAVNS, ear-based stimulation, in IBD contexts, including pediatric proof of concept and other clinical investigations. A 2025 systematic review looked across invasive and non-invasive VNS in gastrointestinal disorders, including IBD, to assess efficacy overall. Why it might help autoimmune conditions. Conceptually, autoimmune diseases often involve persistent immune activation and dysregulated inflammatory signaling. If vagal pathways can dampen cytokine output or shift immune responses toward regulation, that could reduce symptom burden and tissue damage in some patients, at least in theory and in early-stage clinical data. Important caveats: the honest state of play. Not all studies show consistent anti-inflammatory effects, especially across different conditions, protocols, and outcomes. A 2024 meta-analysis reported no consistent anti-inflammatory effect of VNS across studies overall, while noting promise in certain contexts, and a need for better designed RCTs and stratified populations. VNS is not one thing. Implantable cervical VNS, auricular stimulation, and other approaches differ substantially in targeting and dosing, and results don't always translate from one to another. Practical takeaway: the vagus nerve is increasingly viewed as a neuroimmune regulator. In autoimmune and inflammatory diseases, the most credible clinical direction so far is carefully controlled neuromodulation, particularly in RA and potentially IBD, but it is still a developing area with mixed evidence and ongoing trials.